Hello, I'm Dr. Elinore McCance-Katz, the Assistant Secretary for Mental Health and Substance Use. I lead the Substance Abuse and Mental Health Services Administration, or SAMHSA, which is part of the U.S. Department of Health and Human Services. We know the prevalence of mental and substance use disorders in our country is far too great. Even more troubling than the existence of these disorders is the vast number of people in need but who get no treatment to address them. We know that over 90% of individuals with a substance use disorder do not get treatment, and that more than half with a mental disorder also get no treatment. During the month of September, we proudly honor the millions of Americans who have achieved recovery from mental and substance use disorders. These individuals serve as a model for us all. Over the years, we've made impressive strides in the fight against addiction. This year, more than ever before, the ability to achieve and maintain recovery has been challenged. The COVID-19 pandemic has created unimaginable stressors for all Americans, but particularly for those with mental and substance use disorders. The social, emotional, economic, and health fabric of your foundation for recovery have changed. But millions have risen to that challenge and used the principles of recovery to engage and push forward during this difficult time. Each year, September comes, and with it, an opportunity to celebrate those in recovery. This September, I urge you to do that with even more fortitude and strength than ever. I also urge you to remember that while Recovery Month is 30 days, recovery is actually every day for millions of Americans. And it is every day that we should collectively do our part to celebrate the successes of those who have achieved recovery and work to engage those with mental and substance use disorders who need our help to get to their recovery. SAMHSA has taken critical steps to ensure that recovery plays a central role in our work. This year, we're pleased to fund the first ever Addiction Peer Recovery Technical Assistance Center, focused on providing direct training and technical assistance to recovery communities and peers across the nation. We also know that individuals in recovery should be welcomed into the workforce. SAMHSA has recently announced a program which specifically supports individuals in recovery gaining access to meaningful employment. Through programs such as this, and our supported employment program, we continue to remind people across the nation that individuals with mental and substance use disorders should have every opportunity to participate fully in employment opportunities. We must work to break down barriers to care and treatment. We must continue to educate and train our workforce so that when a person with a mental or substance use disorder arrives on their doorstep, they are welcomed by a well-trained, engaging practitioner. We must build our peer workforce so that when an individual in need is in an emergency department or experiencing a mental health crisis in the community, a friendly face is there to help them to that next step. We must continue to expand our recovery community organizations so that when a person no longer wants to use drugs on a Saturday night, they have a warm and inviting recovery center to go to instead. I recognize that the current time demands a different way to celebrate recovery. Maybe the large rally or walk you normally organize is not possible. But I am confident that the communities across the nation will innovate and create hundreds of new models to honor recovery. SAMHSA will be proudly hosting a webinar series which will highlight successes of programs across the country, including those led by individuals in recovery. We must collectively work to bring attention to this critical national health issue. Mental and substance use disorders require, or at least should receive, as large a focus as any other health condition the nation faces. Millions of Americans each day live with the struggles imposed by this health crisis, and we must do everything in our power to ensure that people know that help is available. As the Assistant Secretary for Mental Health and Substance Use, I'm inspired by the millions of Americans who have achieved recovery. I'm heartened by the healthcare practitioners ready, willing, and able to give their services no matter how complex the condition. I'm hopeful that states and localities will continue to expand and enhance resources for those critical health conditions, and I'm proud of the recovery community for doing your part to ensure that your community grows not only in heart, but also in size. I thank you all for your continued commitment. SAMHSA stands with you in this fight, and I'm honored to begin the 31st National Recovery Month. Thank you very much.